Acquired immunodeficiency syndrome. Friends, this is one of the chronic life-threatening condition and final stage of infection by human immunodeficiency virus. Friends, the average survival rate of this life-threatening condition is up to 10 to 15 years. It targets immune system and declines immunity to fight against infections. As the disease progression occurs, opportunistic infection or malignancy develop. That is, infection progresses towards the last stage that is characterized by AIDS. Modes of transmission: unprotected sex, blood transfusion, drug injection needles, or mother to child during either pregnancy, childbirth, or breastfeeding. Now coming towards its symptoms. Friends, depending upon the phase of infection or viral load by human immunodeficiency virus, symptoms they likely to be repeat every 2 to 4 weeks. These symptoms include either flu or fever, headache, weight loss, muscle or joint pain, and lastly sore throat or swollen lymph glands. Friends, this deadly virus targets our immune cells and downregulate our immunity. So here human immunodeficiency virus attacks our immune system and it destroys or deplete CD4 T cells. Friends, normal range of CD4 T cells is in between 500 to 1500 cells per mm cube of blood. But in HIV, this count is below 200 cells per mm cube. Friends, infected blood, semen or vaginal secretion are the major reason of transmission. And lastly, the myth which sounds around that this is spread through air, water or insect, and however this deadly disease does not spread through air, water or insects. Now let's talk something about its history. Friends, this type of infection comes from a type of chimpanzee in Central Africa called as simian immunodeficiency virus, and this occurred during late 1800s. After it passed in humans during the hunting when they eat flesh, meat, or either when they exposed towards the blood of infected chimpanzee. Friends, during 1980s, first case reported of AIDS in San Francisco, and after it became a major global public health issue, and around 36.3 million lives so far affected by this deadly virus. And up till now, there is no vaccine or cure is available of this deadly disease. Friends, as per WHO, in 2020, 6.8 lakhs died from HIV. And there are two types of human immunodeficiency virus. First one is HIV-1, which is more virulent and it is more transmitted. And this virus is discovered by the scientists in 1983. And more than 98% of the cases of AIDS, it is due to human immunodeficiency virus 1. Now, other type of virus is HIV-2. However, it is less virulent and lessly transmitted, and only 2 to 5% cases of this virus occurs. This is discovered in the year 1985. Now, heading towards its pathogenesis. Friends, HIV spreads via sexual transmission from person to person across mucous membrane. This virus is called as retrovirus. Retro means reverse. Retrovirus have RNA genome equipped by enzyme reverse transcriptase, and it is one of the type of viral RNA dependent DNA polymerase. Friends, here DNA is transcripted from RNA via enzyme reverse transcriptase. So during this process of gene expression, virus replicates into host cell and their progeny thus integrates. Friends, firstly it integrates into lymphoid system and then it replicates into CD4 T cells. Friends, eventually during this process, destruction of CD4 T cells occurs and therefore immunity depleted from such important cells of our body. And this destruction initiates via three types of regulatory proteins. They are, first protein is TAT, which is a powerful regulator of transcription. Then REV, which causes process translation. And lastly, very important, NEF. It downregulates CD4 cells, MHC class 1 protein and T cell receptor from the infected cell and thus increases viral spread. Friends, thus overall we can say HIV causes cellular immune deficiency characterized by depletion of helper T cells, or thus causes opportunistic infections, and after some time, depending upon the stage of infection, malignancy also develops. Now let's talk about the pathogenesis at cellular level. Friends, infected blood, semen or vaginal secretions, or during sexual transmission, human immunodeficiency virus, first it transmitted across the mucous membrane and it attack the macrophagic cell of our body. Friends, here not only macrophages but also dendrites are attacked by this deadly virus. After it, it travels through lymph nodes and depletes gut associated lymphocytes. Friends, therefore, here the death of lymphocytes starts. It has been estimated that 10 to the power 10 virus destroy 10 to the power 8 lymphocyte per day. So it is a big amount of lymphocyte destruction. Friends, this is also takes part into the progressive depletion of CD4 cells into the lymph. And when there is progressive depletion of CD4 cells occurs, opportunistic infections develop in infected patient. Friends, there is continuous depletion of CD4 cells occur at this stage depending upon the viral load. And as I said earlier, the regulatory proteins which take part into this process, they causes transcription, translation and finally CD4 T cells depletions. And this is the reason why opportunistic infections, they are converted into certain types of malignancy due to this human immunodeficiency virus and AIDS occur. Now coming towards stages of infection. Friends, up till now we had learned that human immunodeficiency virus integrates into lymphoid system. It replicates there and finally they deplete CD4 T cells count. So first stage of infection is called as acute HIV infection. Now in this stage, few symptoms like flu they occurs. However, the frequency may be or may not be. And this stage 1 is contagious in nature. Now coming towards stage 2 is called as chronic HIV infection. This type of stage is asymptomatic in nature and therefore here the viral load is average as compared to stage 1. Now last stage, deadly stage, which is said to be acquired immunodeficiency syndrome. Now this stage is most severe phase of HIV infection. Here maximum viral load occur as compared to stage 2 as well as stage 1. So here CD4 T cells count is below 200 cells per mm cube of blood. Friends, at this stage, opportunistic infections develops and malignancy occur. If treatment not done at this stage, patient can survive approximately up to 3 years. Now, heading towards its prevention. Friends, the first thing that I want to share with you that the complete cure of HIV or AIDS is not possible. Why? Because of its poor understanding of the pathogenesis of this viral disease. And therefore, some prevention they might include rapid diagnostic tests for HIV, that is antigen antibody test must be carried out via patient if repetitive flu-like symptoms develop. Secondly, limiting sexual behaviors. Use of male or female condoms. Not injecting drugs. And finally, the anti-retroviral drugs. Now, friends, anti-retroviral drugs can limit and improve the patient life at certain stage, and therefore such drugs are used for the prevention or to improve the life of patient. There are multiple type of anti-retroviral drugs. So these category include nucleoside reverse transcriptase inhibitors. Examples is zidovudine and many more drugs are there. Non-nucleoside reverse transcriptase inhibitors, then nucleotide reverse transcriptase inhibitors, protease inhibitors, integrase inhibitors, and chemokine receptor 5 antagonists. Friends, these drugs they can limit and improve the quality life of the patient. And lastly, one more therapy that is called as multi-drug therapy, which is called as highly active antiretroviral therapy, also given to the patient at certain stage of AIDS. They are combination of nucleoside reverse transcriptase inhibitors and protease inhibitors. These drugs are given in combination and the name of the therapy is highly active antiretroviral therapy. Now coming towards its summary. Friends, HIV infection is very harmful and they are unpredictable. Replication of this deadly virus leads towards damage of vital organs and therefore causes opportunistic infections and develops malignancy. And therefore the only approach towards the HIV is antiretroviral therapy. These drugs are given in potent combination to suppress the replication as well as growth of these deadly virus. However, current treatment with anti-HIV drugs or antiretroviral drugs only prolongs the life of AIDS patient. However, it does not cure the infection. True long-term disease-free survival is far difficult. No dose reductions or no drug holidays were the only rule towards its treatment. Therefore, advanced research is still required with increased awareness in society about this disease. So friends, finally these are the references which I had taken for the studies, and if you like the efforts to understand AIDS, then do like, subscribe and comment or share the mechanistic pharmacology by Dr.